Hello, my name is Sam Riggs, PRF 710, California, University of Pennsylvania. This is my rationale for the NASM Optimum Performance Model. The National Academy of Sports Medicine has a personally developed integrated sports performance training program termed the Optimum Performance Training Model. Integrated training, as defined by the NASM, is a comprehensive approach to training that attempts to improve all components required of an athlete so that each athlete can perform at the highest level possible to help prevent injury. Integrated training aims to improve functional strength and neuromuscular efficiency. This is important because functional strength is the ability of the neuromuscular system to contract eccentrically, isometrically, and concentrically in all three planes of motion. And neuromuscular efficiency is the ability of the body to effectively use agonists, antagonists, synergists, and stabilizers to work synergistically to produce force, reduce force, and functionally stabilize the entire human movement system. With basic information about the integrated training systems and how important it is for the development of the functional ability of the entire human movement system, let's focus specifically on the OPT model from the NASM and how it is organized to be effective. The OPT model is broken into three stages: stabilization, strength, and power. To be able to achieve success and full potential at each stage, it is important to build up appropriately. That is done by targeting each stage in order and implementing each phase found amongst the three stages. Phase 1 is stabilization endurance training. Phase 2 is strength endurance training. Phase 3, hypertrophy training. Phase 4, maximal strength training. Phase 5, power training. And Phase 6, maximal power training. The specific components of the OPT model include flexibility training, cardiorespiratory training, core training, balance training, plyometrics training, speed, agility, quickness training, integrated multiplanar resistance training, and sport-specific conditioning. Personally, I feel the stabilization stage of the integrated training model is sometimes undervalued. I feel many individuals do not understand that as you progress through the stages and phases of the integrated training model, it is okay to continue to incorporate stabilization techniques with strength and power training. Just because you have built a solid stabilization base does not mean you cannot continue to solidify that base as training methods become more advanced. Solidifying this stabilization base will also help to reduce the risk of injury. An article from the International Journal of Sports Physical Therapy investigated trunk stabilization exercises and conventional trunk exercises and how they could enhance trunk stability. Strength and athletic performance in high school age soccer athletes revealed that stabilization exercises are effective in improving static and dynamic balance, aerobic performance, and rebound jump. Athletes who perform both types of exercises improved performance in sprint and vertical jump tests. These results show that stabilization exercises can be effective in helping to improve strength and power performance in certain aspects, showing that a solid foundation of stabilization ability sets a ceiling for strength and power. So sometimes some questions that come up from coaches or other colleagues could really involve time, specifically kind of geared toward when are you supposed to do stabilization exercises in the off season, or when is there time during the season to do stabilization exercises. I would basically respond the outcomes targeted from these programs depends on sport-specific demands of each individual athlete. The integrated training model overall incorporates stabilization exercises early into an off-season program, as we've discussed. It will set the base for a higher ceiling of strength, power, and function. The more proficient your athletes are in stabilization skills, the faster and more effective they will be in performing lifts and sport-specific functions, making their overall performance that much better earlier and throughout the season. So that would be a good kind of response to off-season training time and kind of how to break that up. Now, during the season, it gets a little bit more difficult, but I would just remind coaches, specifically I work with middle school and high school athletes, and kind of let them know that they should probably incorporate into their warm-up and cool-down activities just to kind of help incorporate the stabilization exercises. An article from the Annals of Joint investigated the importance of hip and trunk, including the core, complex strength and function for reduction of lower extremity injuries, and concluded that if hip, trunk, and core strengthening and training is incorporated into activity, this can reduce lower extremity injuries, but is most effective when continuously implemented. So it's important to continuously implement that throughout the season for the coaches as well.